Hey there, fellow grad students. Here's a practice test on dissociation and trauma therapy. Question 1. The NP notes that the patient with a somatoform disorder has physical symptoms, but there's no evidence of physiological disease. The client may have decreased amounts of serotonin and endorphins, causing increased sensitivity to pain. This explanation of symptoms is based on what? In A, communication theory, B, humanistic theory, C, biologic theory, or D, genetic theory? The answer is C, biologic theory. So research has shown that brain abnormalities such as decreased serotonin and endorphins may lead to altered pain perception. Genetic therapists believe that both genetic and environmental factors contribute to somatization disorders. Communication therapists, they believe somatization is nonverbal body language intended to communicate a message to significant others. Humanistic theorists, they believe one must look at clients with somatoform disorder in the context of what is happening in the client's life. Question 2. John states, I was reared in a chaotic, alcoholic family situation. You know that the most useful theory for explaining his somatoform disorder would come from A, humanistic theory, B, psychosocial theory, C, biologic theory, or D, genetic theory. The answer is B, psychosocial theory. So psychosocial theorists believe that John did not receive adequate nurturing. Biologic theorists, they would believe that decreased serotonin and endorphins may have led to the altered pain perception. Genetic theorists, they would believe that both genetic and environmental factors contribute to somatization disorder. And humanistic theorists, they would believe that one must look at John with somatoform disorder in the context of what is happening in the client's lives. Question 3. You find that a patient with pain disorder has been in physically and verbally abusive relationship. The patient feels guilty and fears a loss of love. According to psychoanalytic concepts, this is believed to be a unconscious conflict from childhood that was reawakened in adulthood by a similar situation, B, environmental factor, C, stress related to relationships, or D, a brain abnormality. The answer is A, unconscious conflict from childhood that was reawakened in adulthood by a similar situation. The psychosocial theory addresses the psychoanalytic concepts of repressed affect that is transformed into pain. Brain abnormalities as an explanation of the pain disorder reflects biological theory. Stress related to relationships as an explanation of pain disorder derives from a humanistic view, and environmental factors, they're a component of the genetic theory. Question 4. A client is being seen in the clinic for right-handed paresthesia that the client does not seem to be overly concerned about. The condition developed abruptly after being caught cheating on an exam by the teacher. The paresthesia also ended abruptly as well. Which symptom most clearly relates to la belle indifférence? A, being caught cheating on the exam, B, right-handed paresthesia, C, lack of concern over the paresthesia, or D, paresthesia beginning and ending abruptly. Answer is C, lack of concern over that paresthesia. So la belle différence is a French term that translates to beautiful ignorance. It describes a relative lack of concern over a physical problem like paresthesia. It does not refer to the nature of physical problem or the course of the problem. Therefore, the paresthesia itself and its abrupt onset and conclusion are not symptoms of la belle différence. The client may or may not be concerned about being caught cheating on the exam, but that is not a physical problem. Question 5. A 24-year-old with body dysmorphic disorder, also called BDD, tells you that he plans to have a surgical procedure that will affect his appearance. You understand that this plan is an effort to what? A, suppress intrusive thoughts, B, deal with multiple physical complaints, C, treat associated depression, or D, cure the imagined defect? The answer is D. It's to cure that imagined defect. So when clients have BDD, they may use cosmetic surgery to cure their imagined defect. Cosmetic surgery does not treat the associated depression or deal with multiple physical complaints or suppress the intrusive thoughts. Question 6. Jackie, a patient, states that she has been ill and in pain since childhood. Her many symptoms are not caused intentionally, nor are they feigned. She has been seen by many doctors. Consistent with her disorder, you believe that the pain she is experiencing is A, fake, B, exaggerated, C, real, or D, for attention. The answer is C, real. This client has somatization disorder and is genuinely experiencing pain. It's not fake or for attention, as with fictitious disorders or exaggerated. Question 7. Jennifer was admitted to the psychiatric mental health unit. She was missing for 2 weeks and has returned home not knowing any time has passed. Which of the following dissociative disorders has the client experienced? A, amnesia, D, depersonalization disorder, C, fugue, D, dissociative identity disorder. The answer is C, fugue. A person with dissociative fugue wanders, usually far from home and for days, perhaps even weeks or months at a time. During this time, clients completely forget their past lives and associations, but unlike people with amnesia, they are unaware of having forgotten anything. When they return to their former consciousness, they do not remember that period of fugue. Question 8. You are seeing a patient with a history of admissions to several hospitals over the last several years. Each hospitalization was for a different disorder in which there was no physical evidence. The medical records indicate that the patient is a pathological liar. Which of the following disorders does he suffer from? A, somatoform disorder, D, fictitious disorder by proxy, C, adult fictitious disorder, or D, dissociative identity disorder? The answer is C, adult fictitious disorder. So when the disorder is severe, chronic, and unremitting, involving repeated hospitalizations, traveling between different healthcare providers and healthcare facilities, and pathologically lying of an intriguing or fascinating nature, which is termed pseudological fantasica, it is often referred to as Munchausen syndrome or adult fictitious disorder. Fictitious disorder by proxy is sometimes called Munchausen by proxy syndrome, which occurs when parents or caregivers deliberately induce signs of illness in another person, which is usually their own child. There's no evidence in this that the client is suffering from dissociative identity disorder or somatoform disorder. Question 9. An 18-year-old joined the military shortly after graduating from high school and is admitted to the mental health unit for depression and suicidal ideation. He tells you that the military is not what he expected and he wants to go home. You observe a variance in the affect between his interaction with peers and staff. You suspect what? A, conversion disorder, B, fictitious disorder, C, malingering, D, body dysmorphic disorder. The answer is C, malingering. So malingering, what this is, it describes a person that's deliberately faking symptoms. It's usually adopted to obtain a secondary gain. So fictitious disorder, that describes a person assuming a sick role by intentionally producing or feigning illness. People with body dysmorphic disorder, well, they're preoccupied by an imagined defect. A person with conversion disorder will report impaired physical function related to the expression of psychological conflict. Question 10. Oh, if you're enjoying this, please hit the like button and share it with a friend or a classmate. Question 10. You have several clients with somatoform disorders that need regular reassessing of their status. You are aware that it is A, easy to be kind, non-judgmental, and understanding. B, challenging because of the psychobiological factors involved. C, best to include objective information only, or D, best to include subjective information only? The answer is B, challenging, because of the psychobiological factors that are involved. It can be difficult to assess the client because of the psychobiological factors involved. It is not easy to be kind, non-judgmental, and understanding with this group of clients. It's just facts, unfortunate. Both objective and subjective information should be included in your assessment. Question 11. You know that performing an assessment on a patient with dissociative disorder can be challenging. You understand the importance of including which of the following in your assessment? A, memory, B, identity, C, consciousness, D, client's spouse, or E, awareness of time. The answer is multiple, A, B, C, and E, so all but D. So it can be extremely challenging, just as I said in the previous question, when you're beginning to gather data on a client with dissociative symptoms. The major area to focus on during the assessment are identity, memory, and consciousness. Some other areas to assess are awareness of time and the amount of unfinished tasks, goal setting, and inconsistent work attendance. There's no indication that the client's spouse would need to be included in the assessment of the client. All right, last question, question 12. You have diagnosed a patient with dissociative disorder. Which one is an appropriate intervention to promote effective role performance? A, encourage the client to have no contact with friends and family. B, ignore the client's other personalities. C, help the client alienate family members who do not believe the client is sick. Or D, include family members in therapy. The answer is D, include family members in therapy. It's important to work with the patient's family in order to help everyone in the family unit to adjust to role performance alterations. Including family members in the therapeutic counseling relationships helps them learn new ways of dealing with the client. As stated earlier, considerable secondary gain is often associated with dissociative behavior, so that some patients may use their illness to escape responsibility and get special treatments. Families often need support in learning to avoid reinforcing dissociative behavior by acting as the source of secondary gain. Alrighty, good luck on your test. Hope this helps. Share with a classmate.